Hi, I'm Dr. Lisa with Private Practice Made Easy. And in this video, I'm going to talk about or answer the question and give you my response on, is AI going to replace psychiatric nurse practitioners, maybe even nurse practitioners in general? I have been getting a lot of questions about this, a lot of inquiries in regards to, I want to start my private practice, but with AI, am I going to build this private practice and then not have a job? And then I also get questions because I have students who are preparing to be a nurse practitioner that say, is this a good time to go back to school? So in this video, we're going to break this all down for you. So first of all, there's a company right now building an AI, creating AI that can screen, diagnose, suggest medication adjustments in psychiatry and in medicine, period. Okay. So I'm going to speak specifically in this video about psychiatry. So this AI can scale automatically, and the cost is going to be less than $1 per patient. And it's not science fiction. This is actually really happening right now in trials. So, yeah, that's scary if you're trying to make a big investment in whether going to school and becoming an NP, or if you are thinking about doing or opening up a private or group practice. So, listen up. If you are a student or a psychiatric nurse practitioner already, just thinking about becoming one, you're going to want to stick around for this video. Okay? So, let's just get right into it. Again, I'm Dr. Lisa with Private Practice Made Easy. I use AI tools in my work every single day. I've done a very deep dive into clinical AI tools. Use them every day. So they're very helpful to me, and it's kind of like my assistant. So I'm not coming from this place of fear, and I'm not dismissing the concern. The other thing I want to point out is I also have an AI business. It's called Ghost Ops AI, where I kind of got into this because I was trying to integrate AI in private practices. And so I just started up my own company, which helps private practices with automation, voice AI, setting up your whole team as AI agents. It's just amazing. So I've learned a lot in the last year about AI software. So, anyway, I own a software company that specifically uses AI agents. So, and I own a private practice. So, I'm coming from this from both angles. So, I just want to make that clear to you. So let's talk about the real question. I've seen the headlines. I've heard colleagues say, in 10 years, we won't be needed. I understand why people are scared. You spent years in school, hundreds of hours in clinical training, right? You're carrying student loans, building your career. I'm with you there. And now you're watching this chat box on TikTok, right? And the thing is, they're actually on social media showing you like these chat box that look like a pretty decent therapy session. And I have tested these out, and they are remarkable. Remarkable. Like, some of the things I'll like challenge it, like I'm the patient, and I'll challenge it, and the answers that it comes back are truly well versed. And I'm going to be honest, it's better than probably what I would respond in a lot of situations. So that's unsettling. I get it. But here's what I think is actually happening, and here's why the people most at risk are the ones most people assume are not the ones that people assume, right? So here's why the people most at risk are not the ones most people assume. Okay? So let's get into this. What AI can and cannot do. Let's start there. AI, losing my voice. AI is genuinely incredible, as I said earlier. I want to be real honest. The AI tools that I use are like open evidence. Oh, if you haven't used open evidence as a practitioner, oh my gosh, it's amazing. I can sit there and have a session with a patient, and it's bringing up current research. It helps me with pre authorizations. I actually have an AI agent that now, if my patient is getting an appeal, it'll actually dig up the research to support the appeal. It's amazing. um, I cannot look at 1,000 different textbooks or research articles. AI can in a matter of seconds. So these really help um, augment your practice and scale it very quickly. AI can synthesize enormous amounts of data, identify patterns across thousands of cases that you don't even know about, and give information just faster than you could even imagine. So if you're not using it, you should be using it, okay? In fact, I want to go to a provider that uses AI. Like, if you're not using AI, I kind of don't want to see you. So AI, that's what it can do. Now let's go on the other side and talk about what it cannot do, because this is really, really important. AI cannot sit across from a patient who just told you their marriage is just falling apart. Their mother is in hospice, and maybe they haven't slept in 3 weeks. And when a patient says I'm fine, but you read their body language and you know they're not fine. This happened to me yesterday a couple times, right? And I'm virtual, and I'm, because AI is able to take my notes, I am engaged with the patient. So I'm not missing anything with their body language, their tone. So AI cannot build the kind of trust that makes a patient call you at 2 in the morning instead of going to the ER. Not that I really like that, but okay, you get the gist, right? Because you're building a relationship. AI doesn't make you feel heard, right? By another human being. Maybe heard, but not by another human being. AI cannot read the room, it cannot notice things that you would notice, okay? Do things match up, in their body language? So the therapeutic relationship is not a feature that AI has at this point. It is, and that is an important, especially in psychiatry, that is just so important. Like, I build in my private practice, I build relationships with patients, and they want to see me. Like, I have tried to like give them, like, I'm trying to decrease my one-on-one time because I'm trying to build these other entities, and helping other people build their private practices and helping to integrate AI. And like, there are some patients, I built that rapport. That's not going away. They do not want AI. They don't want it. They have no idea that I'm, well, most of them do, that I'm using it to assist with helping me help them. So that's breaking down what it can and can't do. So I want to just make sure that we're addressing that. Okay, so let's now what you're waiting for. Who is really at risk? This is the part that I don't think gets talked about enough. Okay, so psych NPs most at risk from AI um, are not solo practitioners. They're not the ones with their private practices. They're not the ones that built these relationships. They're not the ones building deep personal relationship based practices. The most vulnerable clinicians are the ones that are employed by the healthcare systems. Here's why. When you are employed as an NP in a big, especially big healthcare systems, your value to that institution is largely defined on what you can put out, right? How many patients can you crank out a day in an hour? Okay. How quickly can you document? Yeah, they're going to use AI to help you document so you can see more patients. it does free up a lot of your time. When I'm done with my patient for that session, my note is done. I don't have to take all day Sunday to go back and do all my notes. I remember the good old days, right? So, how many patients can you see per day? How quickly can you document? How efficiently can you move people through the system? That, because numbers, it, it's a business. The healthcare system is a business. So, when a healthcare system can hit the same metrics with less human labor, that's when economics shift, right? That's when the cuts come. So, yeah, it's coming. They're working. It's in trials right now. They're working on AI bots, and probably it's going to be AI robots as well, like that have like look like human skin. Okay? But when you, and they're going to replace you. If you're working for a healthcare system, it's coming. It's in trials right now. So when you own your own practice, you have control. Your value is what you put out. It's your relationship. It's your reputation. It's the reason patients drive 45 minutes to come see me. I have a patient coming from Dallas once a quarter coming to see me. Do you know how many providers there are in Dallas and Fort Worth that they could go see? No, it's because I've built that relationship over years. Okay. So, how to thrive in an AI world? So, here's my actual advice. As someone who uses AI every day, I own my own practice, I own my own AI software business, and I am watching the industry every single day, 7 days a week. I'm in it, like learning the next new thing. And it's every day there's something new that I'm learning. So I'm going to go over some things right now on how you can thrive, okay? So four things. Number one, get comfortable with the tools. I know that feels counterintuitive when we're talking about AI taking work, but clinicians, practitioners who get left behind won't, you know, won't be able to get caught up. So you got to get comfortable with the AI tools. They're going to replace you if you don't get with the AI tools, point blank. Get curious, experiment. If you want help, reach out to me. I am getting ready to start some AI classes for beginners because a lot of people say to me, I just don't know where to start. It's so overwhelming. It's overwhelming for me, and I'm in it every day. I'm learning every day. Okay, I'm building and I'm vibe coding, and it's overwhelming because every single day something new is coming out. So let's start from the basics. If you have a practice and you want to integrate AI, let me know. Like, I don't have anyone answering my calls. I do have AI answering my calls, and it says, it's AI. People know it's AI. But if they need to talk to me, it routes it to my phone. If I'm with a patient, then I'll call them back. So it's not like they can never talk to anybody. Okay, but you got to get used to these and comfortable with these AI tools. If you're not doing your sessions and having AI document for you, wow, it's a total game changer. Okay, so you need to get comfortable with the tools. Number two, use AI to buy back your time. Again, like with the documentation, reduce your time, the documentation burden. Remember, we used to say, I spend more time on the computer than I do with my patients. Now that's not the case. I'm like engaged and I'm not missing anything. I'm not, things that I missed before, I don't miss anything. AI catches all of it, right? It's even at the same time looking up research to make sure I'm giving the best treatment. Sometimes it'll come up with things I didn't think about. It's wonderful. It's helping me be a better practitioner. Every minute I save on this administrative work is a minute I can actually spend with my patient, which is where my value lives and yours does too, right? With our patients. So number three, Specialize deeply. If I were getting into practice right now, I would specialize in something. Now, my private practice, group practice, it's a general. Like we do general psychiatry, depression, anxiety, bipolar, schizophrenia, eating disorders. We do substance use. We do a lot of different things, right? And now we're building it with primary care as well. So we're doing GLP-1s and all kinds of hormone therapy and things like that because we put primary care with mental health to make it more holistic because they go hand in hand together. So, but if I was starting all over, I would really niche down. Like if you wanted to do aesthetics, really niche down, specialize deeply. Um, there is a nurse practitioner right now I'm helping, and she just wants to focus on complex trauma. I was like, oh my gosh, that's brilliant because that's huge right now. Like, there are a couple things we see all the time. A lot more ADHD because of social media, a lot more anxiety, and a lot more trauma. So, that is a specialty that she's going to hone in on. And she's going to like really, really expand and scale quickly, because people who have PTSD and different traumas, they want someone who specializes in complex trauma. Okay. Um, so a generalist can be approximated, a specialist with a reputation in the community. That's a whole different story, and you can scale. So if I was doing it over in a private practice, I would probably really niche down. Okay, the next thing is think seriously about private practice. The healthcare employment model is going to be disrupted by AI faster than you will see it coming. Okay, it's predictable, it's going to happen. The institutions that employ us, they're already looking at the numbers. So, owning your practice, building something that belongs to you, no one can take that away from you. That is the single best hedge against that disruption. You become the one who decides your future, not someone else. Okay? So, just to recap on those four things, get comfortable with the tools, use AI. Use AI to buy back your time. 3, specialize, niche down deeply. And 4, think seriously about private practice. Okay. And this is if you're a student. Got a question the other day. Who is a student who's getting ready to graduate? Can I do my private practice right out of the get go? I've been wanting to do substance use, and she's been working as a nurse with substance use disorders. Absolutely, go into it. Why would you wait? Especially now. Why would you wait? Put in the comments. Why would you wait? All right. So let's look at the big picture. Lastly, as we end this video, let's look at the big picture. Here's the perspective that I keep coming back to. Every major technology shift in medicine, whether it's the stethoscope, the MRI, the X-ray, the electronic medical records, people said it would replace clinicians every single time. Every time it's changed what we do. But it never eliminated the need for human healers. AI is the same shift, only faster, and you got to be in the right place. Remember when electronic records came up and the old school nurses never wanted to come on board? They would like retire. Like half of them wanted to like, I'm not doing it. I'm retiring. I'm not going to learn. Like they couldn't handle the change. So now they had to handle the change, right? Either you get on board or you get out. That's what AI is doing. You get on board or you get out. And if you are working for a big healthcare system, it's coming. The wave is coming, and they're going to, it's a business, they're going to replace a lot of providers. They just are. So I would gear up, get in early, get thinking about private practice. Private practice made easy. We will help you through the stages from the planning stage all the way to opening up your front doors. We integrate AI best practices. And yes, I said best practices. We've created best practices for utilizing AI and integrating AI so that when I say best practices, it's so that we use AI to help give patients the very best care. So anyway, please subscribe if you felt that this was helpful. I am going to be working on the next couple months AI videos left and right. All the newest things that I've learned and implemented in my own practice, and that I am helping others. Again, I'm a business owner on both spectrums here: private practice, group practice, and also I own a software AI business. So if you need help, please say help in the comments, and I'll message you back and we'll get on a free discovery call. All right, have a good week. I hope this was helpful.